Low blood pressure. Causes, symptoms, and treatment. Blood pressure is a crucial aspect of cardiovascular health, reflecting the force exerted by circulating blood on the walls of blood vessels. While high blood pressure, hypertension, is a well-known risk factor for cardiovascular disease, low blood pressure, hypotension, can also be concerning and lead to significant health issues. Hypotension is generally defined as having a blood pressure reading lower than 90/60 mm Hg. This video will drill into the causes, symptoms, and treatment options for low blood pressure. What is low blood pressure? Low blood pressure, or hypotension, occurs when blood pressure falls below the normal range, which is typically considered to be around 120/80 mm Hg. Although low blood pressure can be a sign of good cardiovascular health and physical fitness, it can cause symptoms and complications in some individuals, especially if it drops suddenly or is consistently low. Causes of low blood pressure. There are numerous factors that can cause low blood pressure, ranging from dehydration to serious medical conditions. Understanding these causes is essential for diagnosing and managing hypotension effectively. Dehydration. Dehydration occurs when the body loses more fluids than it takes in, reducing the volume of blood in the bloodstream. This can lead to a drop in blood pressure as the heart has less fluid to pump. Causes of dehydration. Excessive sweating due to hot weather or exercise. Inadequate fluid intake. Vomiting or diarrhea. Fever. Blood loss. Significant blood loss from an injury or internal bleeding reduces the overall volume of blood, leading to a drop in blood pressure. This condition is a medical emergency and requires immediate attention. Causes of blood loss. Trauma or injury. Gastrointestinal bleeding. Surgical complications. Hemorrhagic stroke. Heart problems. Certain heart conditions can impair the heart's ability to pump blood effectively, resulting in low blood pressure. These conditions may reduce cardiac output or disrupt the regular rhythm of the heart. Heart conditions associated with hypotension. Bradycardia, slow heart rate. Heart valve problems. Heart attack. Heart failure. Pericarditis, inflammation of the heart lining. Endocrine disorders. Hormonal imbalances caused by endocrine disorders can affect blood pressure regulation. Hormones such as adrenaline, aldosterone, and cortisol play crucial roles in maintaining blood pressure levels. Endocrine disorders linked to hypotension. Addison's disease, adrenal insufficiency. Hypothyroidism, underactive thyroid. Diabetes, particularly if it leads to autonomic neuropathy. Severe infection, septicemia. Severe infections, particularly when they enter the bloodstream, can lead to sepsis. This condition triggers a widespread inflammatory response, causing blood vessels to dilate and blood pressure to drop sharply. Causes of septicemia. Bacterial, viral, or fungal infections. Infections originating from wounds, urinary tract infections, or pneumonia. Nutritional deficiencies. Certain vitamins and minerals are essential for maintaining healthy blood pressure. Deficiencies can disrupt normal bodily functions and contribute to low blood pressure. Key nutrients involved. Vitamin B12. Folate. Iron. Medications. Several medications can lower blood pressure as a side effect. Patients taking these medications should be monitored closely to prevent hypotension. Common medications that can cause hypotension. Diuretics. Alpha blockers. Beta blockers. ACE inhibitors. Angiotensin II receptor blockers. Antidepressants. Medications for Parkinson's disease. Orthostatic hypotension. Orthostatic hypotension, or postural hypotension, occurs when blood pressure drops significantly upon standing up from a sitting or lying position. It can cause dizziness and lightheadedness and is often due to a delayed or inadequate response of the blood vessels to changes in body position. Causes of orthostatic hypotension. Dehydration. Prolonged bed rest. Pregnancy. Diabetes. Neurological disorders, e.g., Parkinson's disease, multiple system atrophy. Anaphylaxis. Anaphylaxis is a severe, life-threatening allergic reaction that can cause a sudden and dramatic drop in blood pressure. It requires immediate medical intervention. Common triggers of anaphylaxis. Foods, e.g., peanuts, shellfish. Medications, e.g., antibiotics, aspirin. Insect stings, e.g., bees, wasps. Latex. Chronic medical conditions. Certain chronic medical conditions can lead to persistent low blood pressure, requiring long-term management and monitoring. Examples of chronic conditions: chronic fatigue syndrome, fibromyalgia, amyloidosis. Symptoms of low blood pressure. The symptoms of low blood pressure can vary widely, depending on the underlying cause and the severity of the hypotension. Common symptoms include dizziness or lightheadedness, feeling faint, especially when standing up quickly, fainting, syncope, sudden loss of consciousness due to insufficient blood flow to the brain, blurred vision, visual disturbances, including blurred or double vision, nausea, feeling queasy or sick to the stomach, fatigue, unusual tiredness and lack of energy, difficulty concentrating, trouble focusing or experiencing brain fog, cold, clammy skin, especially in cases of shock or severe hypotension, rapid, shallow breathing, increased respiration rate to compensate for low blood flow, depression, feeling of sadness or disinterest in activities. Diagnosing low blood pressure. Diagnosing low blood pressure involves a combination of medical history, physical examination, and diagnostic tests to determine the underlying cause and appropriate treatment. Medical history. A thorough medical history helps identify potential causes of low blood pressure. Patients should provide information about their symptoms, medication use, dietary habits, and any existing medical conditions. Physical examination. A physical examination can reveal signs of low blood pressure and help identify possible causes. The doctor will measure blood pressure while the patient is lying down, sitting, and standing to assess for orthostatic hypotension. Blood tests. Blood tests can check for nutritional deficiencies, hormonal imbalances, infections, and other underlying conditions that may contribute to hypotension. Electrocardiogram, ECG or EKG. An ECG records the electrical activity of the heart and can detect abnormalities in heart rate and rhythm, which may be causing low blood pressure. Echocardiogram. An echocardiogram uses ultrasound waves to create images of the heart, allowing doctors to assess heart function and structure, including valve problems and heart muscle function. Stress test. A stress test involves monitoring the heart while the patient engages in physical exercise, usually on a treadmill or stationary bike. It helps evaluate how the heart responds to physical stress and can identify issues that may not be apparent at rest. Tilt table test. A tilt table test is used to diagnose orthostatic hypotension. The patient lies on a table that is then tilted to different angles while blood pressure and heart rate are monitored to observe how the body responds to changes in position. Treatment options for low blood pressure. Treatment for low blood pressure depends on the underlying cause and the severity of symptoms. In some cases, lifestyle modifications may be sufficient, while other cases may require medical intervention. Lifestyle modifications. Hydration. Increasing fluid intake can help raise blood volume and improve blood pressure. Drinking water regularly throughout the day is essential, especially in hot weather or during exercise. Salt intake. Sodium can help raise blood pressure, so increasing salt intake under medical supervision can be beneficial for some individuals. However, this should be done cautiously, especially for those with heart conditions or kidney problems. Small, frequent meals. Eating smaller, more frequent meals can prevent blood pressure from dropping sharply after eating, a condition known as postprandial hypotension. Slow movements. Taking time to move from a lying or sitting position to standing can prevent dizziness and fainting associated with orthostatic hypotension. Compression stockings. Wearing compression stockings can help improve circulation and prevent blood from pooling in the legs, reducing the risk of orthostatic hypotension. Medical treatments. Medications. Depending on the underlying cause, various medications can be prescribed to manage low blood pressure. For example, fludrocortisone can help increase blood volume, while midodrine can raise blood pressure by constricting blood vessels. Treating underlying conditions. Addressing the root cause of hypotension, such as treating infections, managing heart conditions, or correcting hormonal imbalances, is crucial for long-term management. Intravenous, IV, fluids. In cases of severe dehydration or shock, IV fluids may be administered to quickly restore blood volume and improve blood pressure. Blood transfusions. For patients with significant blood loss, a blood transfusion may be necessary to restore adequate blood volume and pressure. Preventing low blood pressure. While not all cases of low blood pressure can be prevented, certain lifestyle habits can help maintain healthy blood pressure levels and reduce the risk of hypotension. Stay hydrated. Drink plenty of fluids, especially in hot weather or during exercise. Eat a balanced diet. Ensure adequate intake of essential vitamins and minerals, including iron, vitamin B12, and folate. Monitor medication use. Be aware of the potential side effects of medications and discuss any concerns with a healthcare provider. Manage stress. Practice stress reduction techniques such as yoga, meditation, or deep breathing exercises to maintain overall well-being. Exercise regularly. Engage in regular physical activity to improve cardiovascular health and circulation. Avoid prolonged bed rest. If possible, avoid extended periods of inactivity, which can contribute to orthostatic hypotension. Wear compression stockings. For individuals prone to orthostatic hypotension, compression stockings can help improve circulation. Low blood pressure, while often less emphasized than high blood pressure, can have significant health implications. Understanding the causes, recognizing the symptoms, and seeking appropriate treatment are crucial for managing hypotension effectively. Whether through lifestyle modifications or medical interventions, addressing low blood pressure can improve quality of life and prevent potential complications. If you experience persistent or severe symptoms of low blood pressure, it is essential to consult a healthcare provider for a thorough evaluation and tailored treatment plan. If you received value from this video, please like and subscribe to the channel.